I'm Rotimi Jaiyesimi, Professor Rotimi Jaiyesimi, Associate Medical Director for Patient Safety in one of the NHS hospitals. I'm also a consultant in obstetrics and gynecology. My mother was a nurse, and so in my growing up years as a youngster, as a child, I used to visit the hospital. And one needs to be compassionate. And I think the profession in which my mother was and which I saw her exhibit was instrumental to myself going into study medicine. You have to be compassionate. As a youngster going into medical school, you don't know how difficult it's going to be. That is the resilience that you require. But from a patient point of view, you have to be caring. You have to be understanding and compassionate. That's what made me go into medicine. Becoming a gynecologist was not a difficult decision for me. It's because we bring life in obstetrics. Women fall pregnant, have a baby, it's a joyous occasion. In gynecology, women have health issues, heavy periods, they want to have a baby, you're able to sort them out. Again, that's a good thing. We do have cancers in obstetrics, in gynecology, but not many women now die from gynecological cancer. We can now prevent cervical cancer, and I think that's one of the things. It was a specialty I found interesting and rewarding as a medical student, so it was easy for me to choose. Oh, I think it's the smile on the patient's face when you've been able to help them, or when you hear the cry of the baby, and when patients tell you, "Thank you, doctor. I'm pleased with what you've done." Gynecology can be difficult at times. Getting to the underlying cause of issues can at times take a number of visits. It requires listening. And if you don't listen properly, you might miss some points. So I think knowing fully well that a patient has come to see me and they're going away satisfied and more knowledgeable and maybe cured from what's the matter, that brings satisfaction to me. Thank you. I would say is the quality of care that I give to my patients. I believe in quality over quantity. And as such, when you come and see me, when you sit in front of me, you get the time that you require for the condition that you have presented with. So listening, and then explaining to the patients what the issues are, and giving them the choice, involving them in the care in their care. I think that's one of the things the value about me. I think the other side of it is, what do I value about my patients? Well, my patients are women, obviously, as a gynecologist. And what I usually say is, we've got to respect women. We've got to listen to women. And what I tell people is this: I was born by a woman. I am married to a woman. I have daughters. I have nieces. I have sisters. So I will treat my patients the way I want my family, female members of my family, to be treated. So that's what I expect. The mantra I use in my profession, and I have a deep interest in keeping patients safe, and patient safety, which is currently my managerial duty. So what I say is patient-centric care, that is involving the patients in their care, excellent and compassionate care, and safety as the overriding principle.